fat grafting, and at that time, the techniques that were used were not very good techniques. Were not very good, and we were constantly trying to improve the technique. And we went from what we call an open system, where we took the fat out and dumped it into a sieve and just scooped it up with a spoon into a syringe and injected it back, to actually leaving it in the syringe that was taken out, keeping it closed.
Beautifully put, Dr. Newman, especially, that we learned, first of all, some fat is good to have it. And you said these, your main reservoir or stem cells are your fats. And then also the term mother, right? These are really a mother cells, which helping the repair of the other cells. And as a mother, we nourish, right? So I think for a lay person, this is very important information, because we definitely, I think we only very well know about the bone marrow, but the fat is an interesting one to learn new thing. Now, let's talk about the clinical applications. What are some of the most promising applications of regenerative medicine, in dermatology or other areas where this is of highly effective, not just from a cosmetic perspective, but you also gave us the use case of a cancer survivor.
Yes. So I use the stem cells in my clinic through the process that I do, the stem cell lift process, where I take the fat, concentrate the stem cells, and then inject it back. I use it for cosmetic purposes, doing a facelift and rejuvenating the face, neck, and hands using your own stem cells without having to undergo general anesthesia, without having to go under the knife. There's no cutting, there's no scarring. We don't change the shape or look of the face. We're not pulling anything. So we're just restoring everything back to where it was when you were more youthful. We're fixing proportions so we can adjust things and sculpt things to the way we want it to be if things are not in proportion. But that is the huge change from where we were. So we're preventing a lot of unnecessary surgery, where we can get the benefits of regeneration without having to cut and go under the risk of going under the knife or going under anesthesia. The same thing is true for wound healing, for post-cancer reconstruction, in many times in the breast, in the face. These are great cells to put to rejuvenate and renew the tissues in a very safe way. To date, there's no cases reported that stem cells actually induce cancer or cause cancer. In fact, most of the studies have shown the opposite, that they help to prevent or sort of heal your tissues so you don't get cancer. So that's the cosmetic and wound healing for the skin part. For the joints and musculoskeletal, like if you get a joint in your knee or wrist or hands, or if you have arthritis, or if you have any injury from the tendons or muscles, the best treatments today are regenerative treatments. They are by far better than doing traditional surgery in the beginning. It doesn't take away the need for surgery at some point for people. It's just another tool, but this tool is an amazing tool of regeneration. The only thing that will heal the cartilage, so if you fall or if you're doing basketball and you injure your knee, and you tear your meniscus, which is a cartilage in the knee that cushions your knee, if you tear that, it just doesn't heal without surgery. And the only thing that they do in surgery is either sew it up, which is very hard to do because it doesn't have blood flow, or they cut it out and they set you up for getting arthritis. But if you were to put stem cells in, the only thing that actually heals it are the stem cells, because they have a homing mechanism. They look at the damaged tissue, they recognize it, they go there, and they give the signals to the body to heal itself and repair the damage that's there. So a lot of patients now opt to do that, and they don't need to do the surgery. If you do the stem cells and you still don't heal, you can always go and do a knee replacement. You can always do the surgery, but you can not undo the surgery. The surgery is a one-way ticket. And if that doesn't go well, it's terrible. But the stem cells is not a one-way ticket. You can either repeat the treatment again, or you can go to the next thing and do traditional surgery.
So the stem cell, these are like these days are quite in sports medicine, as we read these days, and also you're talking about repairing these injuries, the sport injuries, and rightly said, anything that is under the knife when it is cut, right? I mean, in a layman term, when your skin is cut, there is a lot of associated risk to it, right? I mean, you may heal very well, but then you have associated risk of infection, rejection, depending on what type of a surgery. But stem cells, now, are there any side effects? We know that they really are much safer than any of the invasive procedures. What could be the few side effects of those?
So, like anything that you inject into the skin or into the joint, the biggest risk is infection. So if you use proper techniques, the risk of infection is very low. I used to give antibiotics to people before. I don't do that anymore because the number of infections are so low that it doesn't warrant, in my mind, doesn't warrant to give antibiotics to people beforehand, unless there is a underlying reason to do it. But most people, I do not give antibiotics anymore, and that's the biggest risk. The other risks is, you can have it not take so well, and you may need to repeat it. There are different sources of stem cells. I like autologous stem cells. So I take stem cells from the person's own fat, concentrate it on the same day, and inject it back at the bedside. So everything is done very fresh and very sterile, but it's your own cells that is coming back to you. So you have the least risk of carrying somebody else's DNA into you and having rejection or having in some sort of a infection from another person to you. So that's what I like. But there are other people who um, grow the cells in the lab and they inject it back. You have to understand, if you grow the cells, you don't get all the different types of cells that we get as fresh tissue. When you grow the cells in the lab, you only grow one type of cell, and all the other regenerative cells are thrown away. So you don't get the same benefit as you do as fresh cells. But there is a place for those cells as well, because not everybody can do fresh cells all the time. So there, the other thing is that some people use cells from cord blood, or they use cells from placenta, from different sources that they collected. Um, Unfortunately, we don't have great oversight in the labs that do this, so you have to be very careful. There was cases of people getting really sick from the cells that they got that were not clean. So you have to make sure that the cells are from a reputable source, that the companies are reputable, and the doctors who are doing it know where those cells are coming from, and that they know how they were grown or how they were processed, so the risk of infection or having a transmittable disease from another person is minimized.